All right, welcome to another podcast of Mad in Love. If you are new here, I'm Dr. David Hawkins from the Marriage Recovery Center and the Emotional Abuse Institute. Today, we have something really special for you. We're going to be talking about narcissism and child development. Like, oh my goodness, yeah, narcissism isn't just about those other adults in your life, but they are about young human beings as well. I'm excited to introduce to you LeighAnn Fernandez, who's our newest clinician at the Marriage Recovery Center and the Emotional Abuse Institute. And she just has a lot of experience and a wealth of knowledge to bring to our podcast and to our work that we do. So welcome, LeighAnn. Welcome to our podcast, LeighAnn. Good to have you. I've known you professionally for a time, and our audience, I think, is becoming familiar with you. But would you tell us a little bit about your background and the work that you do here at the Marriage Recovery Center? It's super interesting, and I know people want to get to know you and what you bring to our clinical practice and how you're going to be helpful to them. So tell us about yourself.
Sure. So I'm Leigh Ann, and I've been in the area of trauma recovery for about 20 years. And what I do at the Marriage Recovery Center is I help folks heal from past trauma that affects their current emotional states, relationship functioning, and I just help them resolve trauma triggers that keep occurring in the present from past situations. And I use EMDR and a couple other trauma techniques in order to do that. But my background is actually, I had probably about 10 or 15 years experience in working with children. I started in in-home mental health, actually. So I was making visits to people's houses. I gravitated toward working with foster and adopted kids. So I was able to work with foster families, adoptive families, and helping children with their attachment, with their past trauma, with their behaviors, and just problematic emotional states that would get in the way of them performing their best at school and forming positive, good, healthy relationships.
Now, you've already used some words that I think we got to let people know about. Like, and I know you and I have had some really wonderful conversations, LeighAnn. You've used the word trauma, and I'd like you just to quickly tell us about big T, little t, and then you use the acronym EMDR, and we should let people know what that means too. But tell us about, trauma is a big, I don't know if it's fair to say it's a buzzword now. I don't mean to, I don't say that to minimize it in any way, but my goodness, we throw out the word, I've been traumatized, you've been traumatized, we all been, anyway. All right. But it's a big deal. So tell us about big T, little t, trauma, and yeah, how do you even define that?
So trauma is usually defined by an event that occurs that overwhelms a person's ability to cope in the moment and remain safe. So that can be a physical threat or an emotional threat. And so a lot of times when we're talking in the area of trauma, folks assume that it has to be life-threatening or something that harmed the person in a physical way. But there's also what we call little trauma, which can fall in the category of something that threatened the person's sense of safety in an emotional way or relational way, and also can cause the same long-lasting effects as something like big trauma, which would be a life-threatening event. So little trauma is not less significant. Using the term little doesn't mean it's less significant. It just means—
Good word.
Yeah, it just means that it was threatening in a different way. But those symptoms can be just as long lasting and problematic as those who have experienced physical threats to their safety as well.
Yeah. So, in our work with emotional abuse, narcissism, and so on, if there's a if someone has been emotionally abused again and again and again, whether that could be in a marriage setting, it could be a work setting, it could be with parents. We're going to be talking about children here very quickly. But anyway, if there's a persistent pattern, that can create T trauma as well, correct?
Yeah.
If there's something that happens again and again and again and again and again, and it decreases a person's ability to be safe in that situation. Am I on the right track there?
Yeah. And I could give some practical examples of folks that I've been working with recently that experienced little trauma. For example, if a child was put in a role of parent, the child that's been parentified, and they have the pressure on them to be the substitute spouse or the substitute co-parent of their parent, that can cause a lot of long-term damage that, follows a kid into their current relationships and their workplace, into school. So that's an example. Another example might be bullying in the home or bullying at school. Child may not be threatened with, physical danger, but if every time they go to school or every time they come home, they feel like they can't say the right thing, they can't do the right thing, there's nothing that they can do to be enough in their home or at school, that can create a long lasting effect where the person feels like I'm not enough and I have to behave in certain ways to produce worth. I have to hide who I am. So a lot of times, with little trauma, these things are not less serious. And a lot of times as well, people will think as adults or even as parents of children that are going through something like this, that it doesn't qualify to be a real problem, but it is a real problem. If you find that a child is over apologizing, has low self-esteem, is isolating, won't engage with school, is forgetful, can't remember, things when they were able to do so before. If you see that a child is regressing, there's all kinds of signs to let you know that little trauma has become a big problem.
Boy, that's just so important what you just said, Leigh Ann. So, I'm doing more writing and research and exploring this whole thing about narcissism and emotional abuse trickling down to children. Actually, before we get there, though, what's EMDR again?
EMDR.
I want people to know what is it's an acronym, and it's super useful for any kind of this trauma that we're unpacking here today. But EMDR, go ahead.
Yeah, so I get really excited talking about EMDR. If you guys have seen our other videos about EMDR, EMDR is an acronym for eye movement desensitization reprocessing, and it's a therapy that addresses trauma. It addresses the somatic symptoms that people feel in their body related to trauma triggers. It helps reprocess the emotions and the thoughts that people feel about themselves. And what we do is we use bilateral stimulation along with some of the more cognitive types of therapy, but we use bilateral stimulation in order to desensitize some of those body feelings. And it's very effective. It can be very short term.
Tried and true, evidence-based. For anybody that's interested in, do we know that it really works? It works, and we know it works. Yep.
Yeah. It's been around for about 30 years. A lot of people are like, oh, what's EMDR? I've never heard of that, but it's been around for a long time. There are even modifications that have been developed over the years to address certain issues like anger, chronic pain, all sorts of things that we're able to use EMDR with, not just trauma.
Anxiety. With kids.
Yeah.
All right. So so EMDR, folks, it's really effective. It's been around. I think actually people have heard about it now. So the word is out, and we all know that it's tried and true, evidence-based. It's very, very effective. All right. Let's now segue into what kinds of, when would we use this with kids, Leigh Ann? And can this be done with children online? Like, oh, really? Tell us about what are the types of symptoms that you typically see with children, and what age ranges work well with the MDR with children? Can it be done online?
Yes. So one of the things that I'm noticing with some of the folks that I'm working with now at MRC is that I've been receiving referrals from other clinicians of couples whose kids are having trouble. So some of the things that I've been seeing at Marriage Recovery Center are kids with somatic symptoms, like unexplained somatic symptoms, constant headaches, stomach aches, nausea. They're not really showing signs that you would normally see of somebody who's traumatized, but they're having somatic symptoms that are explained by anxiety at this point because they've done all the tests, the medical tests to rule out physical causes. So that's one of the things I'm seeing. I'm seeing kids who have phobias, like unexplained phobias all of a sudden. I'm seeing kids who have just kind of checked out of functioning. They're not confident enough to go into school and function in school anymore. And so I'm trying to help them reemerge back into life again. A lot of it's complicated, of course, by the pandemic and other things that are causing anxiety. But a lot of these kids, I think, have a lot of chaos that's going on in the home. And it's difficult for them to figure out how they fit into that. And oftentimes I find that these kids are just trying to stay out of the way. And so as they stay out of the way, they're sort of pushing their own mental health needs down further and further, and they're producing symptoms that don't necessarily present as PTSD, but maybe other things like depression, anxiety, somatic symptoms of anxiety, that sort of thing.
This isn't to put a ding on the parents in any way, but boy, you just said something, chaos in the home. So if there's ongoing emotional abuse, that's going to lead to relational chaos, that's going to lead to children getting lost. I mean, in a sense, they kind of have to get lost. Mom and dad are not doing well, and their mom and dad are struggling, and they're blaming and shaming and accusing, attacking, and there's relational stress going on in the parents. Talk a little bit more, Leigh Ann, about what is going to happen to a child, a 4-year-old, 6-year-old, 8-year-old, 12-year-old, 14-year-old, 16-year-old. Actually, we could end up talking about 22-year-old and 24, 26, 28, can't we? Because adult children, the symptoms don't stop. But anyway, we're talking about child development. How does all of this impact children and their development? And maybe, I know I'm throwing a lot at you, maybe if you could speak to what is healthy development, what should be happening with these children, and then contrast it with what is happening with these children. That was a lot. That was about 10 questions in one.
And one of the things I realized that I didn't do for the last question is answer what ages can we see who are online. Yeah. So can I address that first?
Please.
We'll talk about the next thing. I've been seeing, I think it's a sweet spot, perhaps, to see 12 and older for EMDR online. The main issue is that when a person's doing EMDR, they have to be able to sit kind of in a feeling state and not have the urge to get up and move around and play and that sort of thing. If they were in my office and it was a younger child, then I would be able to handle the getting up and the moving around and that sort of thing. But it's more difficult when you're meeting with a kid online. So I'm thinking that probably 12 years old, as long as it's, the 12-year-old is pretty much, developmentally 12, is probably a good sweet spot. And you are able to do it online. You just basically use bilateral stimulation either through taps or eye movements. And the child is able to participate in it just like they would in an office.
Yeah. So if they're tapping, anybody, I think most are familiar now with the EMDR, but bilateral. So whether it's tapping, why don't we show that real quick? Like how would tapping, what would you
Yeah, I
You
usually
crossed
just have
yourself?
people, it's called a
Tap,
butter.
tap, tap, tap,
Yeah.
tap. Okay.
Like a butterfly hug is usually what it's called.
Yeah,
Or I'll
yeah.
have them tap on their knees, like tap back and
And
forth.
the brain is literally going fire, 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 or fire. I better do this right here. Fire, 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 fire. And
Yeah.
something about that unclogs the brain, and you can reprocess traumatic. I was going to say traumatic events, Leigh Ann, but in the case of emotional abuse, it's ongoing.
Yeah.
So it's maybe the way, and then what they end up doing to cope, adapt, or
Yeah.
accommodate
Right.
really ongoing, troubling patterns and rethink things and be able
Yeah.
to be a resource for themselves and recover.
Yeah.
Yeah.
Yeah. A lot of times what I do too with kids is help them understand whatever behavior or emotion state that they're having as a stress response. So it's a stress response. And it's predictable. It tends to happen over and over again with the same trigger. So I try to help them understand that this is a stress response, not just, like a behavior. And I try to help parents, if I'm working with parents too, understand a lot of these behaviors are stress responses of avoidance or, it's a fight, flight, freeze, fawn, those types of things that kids will do. It's actually a stress response and how to work with that. And then in doing EMDR with those kids, I'm helping them sort of unravel that stress response. And then they're able to choose something different because it doesn't feel automatic, like their body and their minds and bodies are driving them toward this behavior anymore once we get it resolved. So,
all right, that's excellent. So back to,
and
child.
You were asking about what a child should be doing. Is that what?
Yeah. What happens to a child's development if there's chaos in the home, or in some cases it's not overt chaos,
right?
Mom and dad are just icy cold to each other. Yeah. One has withdrawn and they don't talk to each other. There's no warmth in the home. It is one incredibly cold environment. And anyway, all right. Yeah. Talk to what should kids, if we had the perfect environment, what would it look like? And then what does it look like? And then how do kids, how do they end up coping ineffectively?
Mm-hmm. Well, I think generally, from birth to launching a kid, for them to develop a secure attachment and secure relationships, and even just an internal mechanism to cope with stress, they're needing to come to the caregiver in some sort of way with needs every day and have those needs met. And if a child is in a home where there's a lot of abuse or narcissistic abuse and chaos and just, the distraction is what's going on in the marriage, there's so many missed opportunities there for a parent to meet those needs. And so the kid is developing in such a way that they're picking up on the modeling, but they're also having these needs and they're going to parents. Parents are distracted and they're not able to meet these needs. Some, the parents that are more emotionally abusive can be even punitive when a kid comes to them with a need. But maybe the parent who's being abused emotionally is just distracted, spent, depressed, sick. Like you've written a book about that are sick. I've worked with lots of folks that are victims of this emotional abuse who were sick for many years and unable to care for their children like they wanted to during those years because of their mental illness, because of their Crohn's disease, because of complications with Lyme disease, all these different things. And so it just creates this vacuum for a child to sort of fall on their own, rely on themselves. And they're doing so with a kid's understanding of that. They're not being parented, really.
Leigh Ann, it occurs to me, I'd like you to speak to, as we talk about this, I'm thinking of the parent who's under serious distress, who's experiencing serious distress themselves. And to think that they're not providing a place of secure attachment to the most important individuals in their world, their children. That just, I mean, it just occurs to me right now that what we're talking about, this could be a really difficult conversation for the mother or the father to be thinking, my goodness, what we're doing is impacting these little children. I'm not even sure what I'm asking you, but I'm just aware I'm thinking of a mother maybe who has a 4-year-old and an 8-year-old and a 12-year-old, and she herself is miserable. She's unhappy. She's in an abusive relationship. She's chosen for various reasons not to leave. And she's now becoming aware that these three, oh my goodness, the lights of her life are not doing well. Or maybe she doesn't even want to see that they're not doing well. I don't know. Speak to how do we help her feel like, oh my goodness, look, it is what it is, but we can help you help your children cope more effectively.
I think a lot of the mothers do know, like they know, they might not know the full extent of what is developing in their children, because their children are getting really good, like over the years, they're getting really good at masking. So a lot of times it doesn't come to their attention until there's a big problem or, some symptoms. But I think a lot of them, they do know, but they're just living day to day in this crisis mode and just doing, whatever they can to survive. So this higher order parenting that we need to do, to help our children develop these internal mechanisms to cope and model, good relationships and positive conflict resolution. Like that just can't be done until this relationship stuff is resolved. And so a lot of what I'm doing is just come alongside of these parents and the kids to help them develop ways to cope with what's going on in the home. For some kids, they're saying they're very aware of what's happening with their parents. And they're, like empathic themselves and sort of pick up on the stress, even if it's not right in front of them. They pick up on it. Some kids will distract themselves by, getting really into their own interests or their own friends. There's lots of different ways that these kids sort of turn to cope with this type of stress. But I think the moms are pretty aware usually that they're falling behind. They're falling behind in a lot of ways, and it just sort of snowballs over time. And it's really difficult, I think, to cope with that, to cope with knowing that you can't do the things that you need to do. Mom guilt is real for everybody,
Okay.
Whether you're doing all the things or not, it's real. So if you're falling behind and you're falling behind, then it just sort of snowballs the whole thing and impacts.
What are some of the ways that a parent can say, what are the traits? What are the indicators? Leigh Ann, you've already mentioned some of them, but what if it reaches this level, then, oh yeah, boy, pick up the phone and give us a call. What are the things to really watch out for?
That's a good question. I think when you start to see that your kid is regressing, like let's say they were really independent before, they could get up in the morning and go to school, set their alarm, fix their breakfast, fix their lunch, do their schoolwork without you staying on top of them. And now all of a sudden they're needing, lots of reminders. They're needing lots of, supervision that they didn't need before. Regression.
Yeah.
I would say, that's probably an indicator that something is going on and that it's starting to get to them. if you have a kid who is apologizing for everything, like apologizing, kind of capitulating relationships where
Oh, so
they're
good.
trying so hard to fit in at school and they really need acceptance from their peers and they will do anything, put themselves in dangerous situations. I've seen even teenage girls be, coerced into doing sexual things before they really want to, because they're trying so hard to make sure that they don't upset anyone. That's the result of them being in a relationship with an abusive caregiver sometimes. Like, you just have to make sure that you fit the mold and, do everything that you can to stay out of the limelight in a bad way. So sometimes you'll see kids being a little codependent, you may see kids with, like I said before, somatic symptoms that pop up that they didn't have before. Headaches, stomach aches, things like that come up and cause them to not function as well.
Yeah.
Panic attacks, like I've seen some kids that start having panic attacks.
Yeah.
Trying to think of other things, phobias.
Well, so let's take one or two or three of those, and let's talk about how would EMDR help that. I wrote some notes here. Maybe we could talk, Leigh Ann, about, so a mother calls you and says, look, my 12-year-old just did, something's happening here. So there's changes. She is regressing. So I'd love for you to speak to how might you approach regression? How might you approach somatic symptoms? How might you approach panic? I don't know. How does EMDR help any of those things?
Well,
pick one of them, or
one of the things I love about EMDR is if we're dealing with the somatic symptoms in the body really has wisdom to tell us where to go to find the root of where it started. So a lot of times, if kids are coming to me for somatic symptom, I will have them expose themselves to that somatic symptom. Like, what did it feel like the last time you felt that? Where do you feel it in your body? Now, without trying to think too hard, just float back to the very first time you remember feeling that feeling. Sometimes they will find a traumatic memory right then. It's very easy. Like, if they are in the feeling and they float back and just kind of intuitively let their body take them to the place that it started, oftentimes there's a traumatic memory there. And we can work on that memory. And it has a generalizing effect to the present. So if we work on that memory and desensitize the feeling that they felt in that time, then oftentimes they don't deal with that feeling in the present anymore. If we can't find a traumatic memory, because sometimes these kids that I've been working with are in denial that anything is bothering them. So they're saying, parents' marriage isn't a problem. I'm fine.
Oh, yeah. Right.
There's nothing wrong here. There's nothing to see here, people. Like, they're kind of like that. When I have a kid like that, we treat it as a state. So when you're in that state, let's try to desensitize that state. When does this state come up? It comes up, first thing in the morning. Like, I had a kid recently, state comes up first thing in the morning. So first thing in the morning, I'm giving him some skills. He's doing some self EMDR a little bit, and then also trying to desensitize that over some time as a state. It's a whole lot easier to desensitize it and reprocess it if we can find the memory.
Okay.
As a state, we can still get a hold of it and decrease it significantly. So I try to go back to the root, and it's very easy. So if they're talking phobia, if they're talking, I don't want to go to school, I have panic attacks, just exposing themselves to that feeling and then asking them to go back to the first time they felt it. And usually their mind will pick it right up.
I've heard it said, is this something you do, have them explore the first or the worst? Is that a common phrase?
Sometimes I say the first time or an earlier time.
Not first or worst?
Yeah. And
necessarily?
sometimes most of the time I don't do worst because I'm trying not to have people too flooded at first, like when we're right in the
Oh,
beginning.
okay.
If I have them look at the worst, then sometimes they're like, no, heck no, Leigh Ann, I ain't doing EMDR again because that's too uncomfortable. So I try to start out slower, with things that are maybe distressing at like a 5 or a 6 rather than a
Okay.
10. And that helps them gain confidence that they can do the bigger stuff once they see the smaller things decrease. And once they see, the parent see and the kid sees that it makes an impact immediately in their functioning, like the next week. Like a lot of times they're seeing impact that quickly. So they come back and they're like, yeah, let's do this again. I thought it was going to be awful, but it's really not. Let's do this again. So they're really excited about doing this work.
Speak to I think it'd be pretty common for 10, 11, 12, 13-year-old to just say, nah, I'm not, mom thinks that I'm more irritable, but I don't think I'm more irritable. They think that their fighting affects me, but I don't think it affects me. Where would you go with that? Where might you go with that?
That comes up a lot. Mom thinks that my relationship with dad is what's causing me all these problems.
Uh-huh.
But I don't care about him. I really don't care about him. I have written him off in my heart.
Yeah. You're on to something, right? I hear this all the time. Yeah, go ahead.
Yep. So I say, okay. And I just accept that. Okay.
Or mom might, this is up on a tangent, but I hear women talk like that too. Like, I'm not, I've just decided I'm going to let it go.
Uh-huh.
Okay. Anyway. All right. So,
so I'll say, if it's not that, if it's not dad, maybe it's something else. It could be something else, but how does it show up currently? Like, how does repressing these feelings and pushing them down show up currently? I think I had a discussion with a teenager who's very stoic and very performance related.
Yeah.
She's she's just on top of things. And I had a discussion with her. As a very, matter of fact discussion. It was so funny. But she asked me, Leigh Ann, why do you want me to feel these things? Why do I have to feel?
Yeah.
This doesn't make sense to me. I don't want to feel. That's just
probably. Well, I'd love to hear your answer to this because I think there's a lot of adults that say the same thing. I get the same thing. Why do I want to feel sad? I don't want to feel sad. Why would I want to feel hurt? I don't want to feel hurt. I don't want to feel any of that stuff. And what do you say?
I tell them, I told her especially, like, if you push this stuff down, it comes up in other ways. So, for example, have you ever been in a discussion with your mom? You've had a really hard day at school. You're in a discussion with your mom, and all of a sudden you're irritable and you're snappy, and you're coming back at her. And now you're in trouble because you're snappy with your mom. And it all started because you were having a rough day at school, but you didn't talk about it. You didn't process it. And here it is becoming a problem in other areas. I was like, that's why it's important to deal with emotions and to take care of emotions. And then other ways, like somatic symptoms. Have you ever had a headache or a stomach ache? Have you ever felt panicky? Have you ever had a test where you're sitting there trying to take a test and you cannot come up with the answers because you're so panicky that your brain won't produce the answers? Like, these are ways that stress comes up, and you need to learn some skills to deal with this. Or the other thing I'll say to people in general that are suffering with trauma symptoms or kids that are avoiding emotions is, when we do EMDR, we're going to those feeling states on purpose so that we can resolve them, instead of you having them sneak up on you every single day as a trigger when you're not expecting it to come up. So it's like you're taking control of this feeling, and we're going to do something with it so that it changes from now on, so that when you're triggered, it doesn't come up as a 10, it comes up at a 2 or not at all.
So you may be touching on something that I think is critical here. you're going to help this child cope more effectively, but the trouble is still continuing to swirl in the home.
Yeah.
So, because I'm going to generalize now. So dad still tends to get angry and stomp out of the house. Mom tends to still tiptoe around dad. This is just an example. And this 12-year-old, so what are you going to say to her or him? Because the junk, the stuff in the marriage is still swirling about the home. And yeah, okay, take it from there. What are we going to say to this 12-year-old that she won't probably very clearly say, well, yeah, but look, nothing's going to change. Now, what are you saying to this child?
So, like, I was thinking about too, as you asked that question, some kids are I'm going to give you examples that I've seen. Some kids are going to go upstairs when all that's going on and be in their own little world.
Probably, many.
And not deal with feelings. And all those practice sessions of going upstairs, checking out, doing their own thing, there's still all this chaos going on in the home that's affecting them and their emotions and their body, but they're checking out. So it's practice dissociating, which is problematic, right?
Yeah.
Some kids are going to hop in the middle of the fight and try to help them resolve it. Like, that's going to be their response. So then, they're becoming kids that are having trouble feeling like the marriage problem is their problem and become overly responsible for it. Some kids get really angry and start acting out to try to make a distraction parents so that they stop tending to their own conflict and now tend to the child. There's lots of different
Take
ways.
one of those ways and walk us through what would therapy look like? What would good therapy look like? Any one of those examples. The child who goes upstairs and dissociate. Take that one.
That's probably the most difficult one, but I'll take that one first. But that one is like really trying to help a kid understand that the feelings go somewhere. They don't just disappear.
Mm-hmm.
And so, like, for a 12-year-old and older, I'll start asking them questions about how this shows up in their life, like how, checking out of feelings serves them well and how it doesn't serve them well. And they probably had examples of both. Like, it can become something that's, reinforced. Like, let's say they're in sports and they check out of emotions and perform really well. Like, that serves them well. Or let's say that they can compartmentalize and go to school and do really well in school. But it usually shows up somewhere. And so I try to have them kind of take an inventory of where does it show up? And then we do EMDR to try to help them to feel. Like, I actually try to help them experience feelings on purpose so that they can learn to deal with them. And then also just they need some education about how to express feelings. Most of the time they don't know to look inside themselves and say, this is what I'm feeling, and then verbalize it or do something with it. So that's what that kind of kid probably needs. The one that jumps in and makes it their problem, a lot of times they're already starting to develop those codependent behaviors. And they're also very stressed out because they're not able to help their parents' marriage. Like, that's very stressful because they feel like it's their job, to make dad see or to make mom, do better boundaries or make, help mom feel better because she's sad. And so they will take on too much responsibility. So I try to get them to start in a more balanced way with, is that really yours? And what can you reasonably do as a kid? Like, you're not an adult in this situation. It's not your job. So what can you reasonably do as a kid?
So you've helped this 12-year-old to understand that feelings don't just disappear. So she now, I'm making up a situation. She now can identify that it stresses her out when mom and dad are downstairs. There's so much tension in the home. It's just crazy.
Yeah.
So she now comes to understand this. She can feel sadness. She feels her hurt. Take it from there. Then what might you help her do with her sadness, her hurt, her tension? You're helping her not to take responsibility. It's not her problem.
Yeah.
But she's still now, it's 8 o'clock at night. She's still upstairs. Mom and dad are still tense downstairs. Anyway, take it from there. What might the therapy look like? What might the EMDR look like?
Yeah. Well, I think I would do two different things. I could do two different things with that same issue. EMDR would look like, what is the belief that she believes about herself? Which is probably something in the area of, I can't control it. Like I'm trapped. Sometimes people feel trapped. I'm trapped in this home and my parents are fighting and I can't take it. And so in that, we would try to help her feel less stressed about that with EMDR. So less, intensity in those body feelings. The beliefs start to change about, is it her responsibility? Then also I would use DBT, which is like a skills training, basically. So DBT would be more like distress tolerance. So what can I do when I'm in distress? She might start thinking things like, I'll put earphones in, I'll distract myself and do something different so that I can cope. I might,
call a friend.
Might think this too will pass. This fight won't last forever. At some point, they're going to stop and everybody will be fine. So this too will pass. Just different mindsets that they can use to tolerate the distress.
Yeah.
So I usually do a blend of EMDR and skills training with a lot of these kids because they're stuck in this home, they're stuck in this home. They're having to learn how to cope with the distress of what's going on. They have to learn that it's not their job to fix it, whether they're stepping in and trying to mediate or acting out to fix it. Like that third kid I was talking about is acting out to try to provide a distraction. Those are the kids that come to therapy and they're the identified patient.
Yeah. Yeah.
So like, this kid right here is causing so many problems in our home. Please fix them. Like that's the identified patient type of kid.
This is so helpful. One more question on this whole topic, and that is, can NPD parents that have narcissistic personality traits or emotional abuse, can they pass on some of these behavior traits to their children? And if so, how do we prevent that? That's kind of a big topic.
I think that's a huge topic that's very under discussed, if that's a word. Because, like the parent that's not having narcissistic traits is so worried that they are going to have children that have those traits that they can start feeling very fearful and almost parent out of fear, parenting out of fear that that's what this trait is going to become, because they know the destruction that it has caused to life as they know it and what destruction it can cause for that kid's life. So I think, part of the issue is the non-NPD parent having a lot of stress about that and maybe overseeing traits. And part of it is that they are displaying some of these traits because it's being modeled. It's being modeled over and over again. So, I mean, I feel like there's a lot of different ways to address it over time. One of the things that I think can be really helpful is for kids to have other examples. So, like, if there are healthy families in your community, those kids need to be exposed to those healthy families.
Yeah, yeah.
If there's a teacher that treats them respectfully and they feel good around that teacher, like, it's good to have conversations with kids about what is that adult like and how does that adult make you feel? What traits about this adult do you want to emulate in the future?
Love it.
And try to get the kids to see other examples that are modeled for them that are not in the home. The other thing is empathy training. Like, a lot of the kids that are growing up with narcissists have either too much empathy, right? More codependent, or not enough. And so for the kids that aren't displaying a whole lot of empathy, it's important for them to start learning what it feels like to be in this other person's shoes. So just having conversations with kids about that, I think, is important. But it's a very tense and important issue, I think, for parents. A lot of times I see kids reach, and it seems like it happens around 12, 13 is what I've noticed. This age of where they start to look at their parents' behaviors, the parent that has more disordered behaviors, and they say, I don't want to be like that.
I think so.
And when that happens, that is a golden time to do therapy. Great time to do therapy, because at that point, the kid's really motivated to learn some new patterns.
I love that. So if a parent starts to hear that stuff, that's a great time to intervene and allow and encourage that child to have a voice right there. Like, wow, what are you seeing? What are you experiencing? Why are you having those feelings?
And like, if I'm seeing a kid like that, I don't want the kid to come to do therapy to slam the parent that's having.
Yeah.
It's not like that. It's more, what is the fruit of what you see in these behaviors? Like, how does it affect you? How does it affect your mom? How does it affect your siblings? Do you see these traits in yourself? How can we turn this around? Where did you learn? Where did that start for you? Can you remember the very first time? And it's a lot of times it's about control. Like, how do you exert control over people in conflict? And they've learned these patterns of how to do that. So oftentimes I'm doing EMDR to help them find those places where they learned, I've got to be in control. I can't let anyone have any control, those types of things. And so they're really willing to learn new skills at that time. It's like if your kid came to you and said, I really want to take piano lessons. Like, you would put them in piano lessons, right? Like,
yeah.
Piano, yes. So if it says, like, I'm noticing, that I sometimes have these traits and I don't want to do that, that's a really good time for them to start learning new skills.
And just to make this incredibly clear to everyone listening, talk about it. So you as a parent, you hear, I think I want to take piano lesson. Take me. Oh, come on. Did you just say, like,
yes.
Anyway, I don't want to be like dad. I don't want to be like mom. I don't want to. Let's talk about what's percolating. There's a phrase I like to use in counseling, Leigh Ann. It's this: make the unspoken spoken. Make the unspoken spoken. What's going on? The elephants in the room. Let's talk about it. So, yeah, you're modeling that, Leigh Ann, for these children who let's take what's going on in their lives and what you're hearing, and give them a voice. Is that's the deal?
And, a lot of times they've been denying their own issues for so long that sometimes if I'm in a session with a kid, and other therapists that work with kids will say similar things. If they've been denying their issues and pushing them down, and the issues don't have a voice, they're not spoken, like you said. And I start giving a place for that to be spoken about, or helping them interpret some of the traumas and the behaviors or the attitudes and beliefs about self that they've turned into, they'll just start crying. And they're not crying because they're traumatized. They're crying because it's finally validated. Like they're finally seen. And it's kind of a beautiful moment because at that point, once an adult or caring individual, even a friend sometimes, does that for someone, especially when they're young, it's like now it's okay for them to validate their experience because somebody else has done it. So it's really neat when that happens because, sometimes they'll say, I'm crying. I don't know why I'm crying. But usually we kind of trace it to, I finally now understand that this is my experience and this is okay and this is normal.
Well, on that note, we're going to bring this to a close, Leigh Ann. Thank you so much for being here. And if you would like, you can hear the compassion that Leigh Ann brings, the passion that she brings, the compassion and the passion that she brings to her work. And if you would like to contact Leigh Ann for EMDR work, for counseling, you can schedule that through our client care team by calling 206-219-0145. And listeners, as always, if any of this resonates with you, please know we are available to help. That's why we're doing this. You can reach out to us by visiting www.marriagerecoverycenter.com to learn more about what we do. You can find more information in our show description. If you enjoyed today's podcast, please give it a 5-star rating and be sure to subscribe to our channel to be notified of new episodes. Thank you, Leigh Ann, and thank you all for tuning in, and we will talk again soon. Take care, and God bless.